Welcome to another edition of Mo Health Media. My name is Guy Danhoff, and today we're going to tackle the world of diabetes management and even training during the pandemic. I am joined with Katherine Park. Katherine's with the Parkway School Districts, and Katherine, welcome to our broadcast.
Thank you so much for having me.
So, Katherine, we really want to start off with asking the question. We know that, just a few years ago, you had been working on the diabetes training guidelines, and I know that you did that in conjunction with, Laura Beckman right here with Missouri Healthy Schools. If you could bring us up to speed on what you did then, and more importantly, what you're going to be doing, because from what I understand, you're going to be launching some new guidelines, I believe, in May or June of 2021.
Mhm. Yes, that's correct. And originally, when we put out these guidelines, that was back in 2014. And we felt that we wanted to address the CADES law, which had just come into play in Missouri about training non-medical school staff. So that was then, and so many changes have taken place since then that we felt it was really important to provide people throughout the state, in particular school staff and nurses, with updated guidelines. And that will include updates to that reflect the COVID situation that most schools have found themselves in the past year. And it will also include a lot of updates relating to all the new technology that's out there.
So with that being said, question is, since March of 2020, when the pandemic first began, what trends have you seen that is directly related to diabetes management within the school setting?
Well, one trend would potentially be that due to the concern that a lot of parents of diabetic students have, they have not been coming to school. In my case, in my school district, we went back part-time in late fall of last year, but not everyone came back. Some students were given the option and have continued to just remain virtual. But with that, with coming into the nurse's office for daily medication management, many parents and school nurses had concerns about how to manage students that do need daily interventions from nurses in a safe way that doesn't put them at risk for coming into the nurse's office several times a day when there might potentially be other issues or students with COVID-like symptoms ill in the nurse's office. So we've tried to manage and juggle all of that.
So with that being said, what kind of successes have you seen? It could be, again, maybe at a case study level, or even maybe some other things you're involved in, even outside your school.
Speaking for myself, I made the decision, and many nurses in my district did, to take the nursing care kind of on the road this year throughout the building by going to meet students where they're at or just outside their classroom, as opposed to having them come to the nurse's office. So because of that, I feel I've developed stronger relationships with the several students that I have in my building with diabetes. They've been able to work with me just one-on-one as opposed to a rushed, busy nurse's office. It's almost like having appointments. So we've been able to have better conversations, and I've been able to, I feel, assist them in a more effective way because of that.
And then did you do any work, I believe, maybe with WashU on some project?
Yes, starting this past fall, I was asked to be a consultant with Dr. Ahn, who is from Washington University. He was working on a research project that has since been submitted to be published. The project involved interviewing school nurses throughout our state and finding out best practices and finding out how training was being done, if it was being done in the school setting for diabetes management, just all things diabetes that were occurring throughout our schools in our state. So we sent out a survey, and more than 200 school nurses have so far responded to that. And this has been submitted for publication, and he is already working on the next phase of that, which will be to provide resources to school nurses and schools throughout the state.
Catherine, that's a very cool project. I cannot wait to get those results and share them on our next broadcast with you.
Oh, absolutely.
You know, I can only imagine the process of the things that you've learned, you know, through that kind of information. So I know you can't really divulge too much of that because obviously it's getting set for publication, but
Mhm.
we will report that as soon as, you know, that study comes out that you can give
That's
to us.
great.
That way everyone can benefit, certainly in Missouri, from, you
Mhm.
know, hearing the results of that study. All right, so now as you think about, you know, 2021 moving forward, we're now beginning the spring semester. And I know that Parkway, as you said, you know, wasn't face to face. Now you're going to start that coming up, what, this coming week? Is that right?
This week, as of tomorrow, actually, we will be back full time, and that'll be a first for us because we haven't been there since last March. We started back in the fall, late October, part time. So this will be the first time that everyone is coming back together, the students, all at once. Um, Similar to the changes any new school year brings, I guess, but in light of the changes we've had in place with COVID, that will no doubt, require even more um, close attention to all the things that we've been working on this whole school year, really, this whole year, as far as social distancing and things like that. So we'll be we'll be hoping to maintain all the COVID precautions that we have in place, and I will be planning to continue to go on site to the classrooms to deliver medications and assist with the students with diabetes. It'll be busier. I'm anticipating, so my time may need to be readjusted a little bit, but we're planning to continue with that for the rest of the school year.
Absolutely. Obviously, you know, we want to wish you the very best because I
Thank
can
you.
tell you when we went at my school full time, face to face, and then eventually had to have a hybrid model as well, you know,
Mhm.
throughout the semester, that you're going to find all kinds of new things, you know, popping up that you may have considered, but you didn't necessarily consider how in the world you can best, you know, use best practices to address those issues. So it will be interesting to see what
Mhm.
you learn in this process, but sounds like your school district is very well prepared as tomorrow you begin a new chapter after what, just 10 months ago, right? 10 months ago was the last time you had full-time school.
Yes, yes. It's been a
So
long, long
yeah.
week.
So with that, Catherine, are there any resources that you would like to share for our audience? Because I know our audience is always requesting resources from us. I
Mhm.
was wondering if you had any good ones that speak directly to diabetes management.
Yes, absolutely. I have them right here. So I'll just put this up to show you, but also I think you're going to provide a link um, so that everyone can access this. This is considered the school nurse Bible, so to speak, school nursing and comprehensive text. And this is a brand new edition that came out, about, I guess, 2 years ago. It's been updated a couple times, but that really is the definitive guide for school nursing. There's a very long chapter on diabetes management in that text. And also, I wanted to also show this from the American Diabetes Association. And it's called Diabetes Care Tasks at School, What Key Personnel Need to Know, School Training Modules. Now, this is a CD and a DVD that the ADA used to give out for free, but all the resources on here can be obtained for free online. So it's just a wealth of resources from the American Diabetes Association regarding diabetes and staff training.
Absolutely. And thank you, Catherine, for sharing that because what we're going to do is we're going to put both those resources right here in the link on this YouTube description, as well as more background on you, perhaps even a contact information. So if other school districts have questions, they can go to you to, you know, you can help, you know, answer any of their questions. And Catherine, I want to give you one final word. Is there any, you know, perhaps advice that you have for parents specifically as school begins tomorrow?
Um, I guess I would say, speaking from my own personal experience, is that I know parents are nervous. I hosted 3 virtual events this past fall for parents of students with diabetes, And it was an opportunity for us to all talk. School nurses were included on this. And we had some guest speakers. And the recurring theme was the parents' concern over their children, you know, whether they would be safe in this era of COVID, being back at school and being back in a nurse's office, things like that. So I guess I would say that, you know, I've been working a lot with how to manage things a little differently, as I said, with visits to the classroom. And I think our students with chronic health conditions will still be our number one priority. We want to keep them safe. At the same time, we're keeping a safe environment for everyone. So I think we'll just continue to be doing that. Even with us back full time, we will still be having in place all the precautions we have had 6-7 months now to get used to. So hopefully that will just continue on and get us through at least the rest of this school year.
Well, thank you for sharing that, Catherine. And certainly thank you for taking the time to visit with us, as we know that diabetes management is really, again, one of those diseases that does need special care to manage. It's hard enough on its own. Now you throw COVID into the mix.
Right.
It makes things very much more complicated. So I want to thank you for your time. We want to thank everyone for viewing this edition of Mo Health Media. We'll see you next week on next week's broadcast right here on Mo Health Media. Thank you.